All right, let's go to the Horn of Africa now, and growing international concern over reports of massacres in Ethiopia's northern Tigray region. The USA is sending an envoy to the area. There has been conflict in that region since around November last year. Prime Minister Abiy Ahmed sent in troops this after the Tigray People's Liberation Front attacked a government military base. But just this week, horrific stories of civilians being massacred, apparently by Ethiopian troops. Let's talk now to Bori Lekranse, Head of Communications in South Africa for Médecins Sans Frontières, or Doctors Without Borders. Thank you so much for joining us this evening. So there are awful eyewitness accounts starting to come through. This is despite a blackout in the area of comms. Ethiopian soldiers apparently going from house to house, massacring civilians. This is sounding utterly awful. You have doctors with MSF working in those areas. Can you tell us what reports they are getting and also in turn what they are experiencing?
Thanks, Sally. Yeah, the situation in Tigray is, it's absolutely unacceptable. And when our teams are on the ground, are working in several instances to try and rebuild, rehabilitate and support the health system that has been deliberately targeted over the last couple of months in these hostilities, in this violence. It's quite a depressing and very disheartening picture. So to give an overview, 106 facilities that our teams had visited over a period of time in this area, 70% of them had been looted during the conflict, which is absolutely unacceptable. Under international humanitarian law, medical care, healthcare facilities, civilian areas are not to be targeted. And that's exactly the opposite of what's happened in Tigray. They were targeted. In fact, the looting and the damage to these facilities are rendering them absolutely useless to a population that needs it now and in future in a very, very significant way.
What are you able to understand? And I understand that there has been a communications blackout, so it's really difficult to know what's going on exactly. But we hear that there are a lot of people who are just fleeing to Sudan. But do you have numbers on how many people are fleeing the country, how many deaths there have been, how many casualties there are?
It is really difficult to operate in this part of Ethiopia, so we're very much reliant on the information that we can have. The situation in larger towns is improving over time as things are less intense in terms of the conflict. But the main concern is people living in, or who used to live rather, in remote areas, in rural areas. And that's really difficult to access at the moment to get an independent view of the situation. So when our teams are currently doing the work, we can see that there's a lot to be done to fix the health system. Since November, there's been a massive disruption in terms of healthcare services, particularly for maternal and childcare. So no vaccinations have occurred since November. If you have large numbers of displaced people, as we do, both internally in the Tigray region of Ethiopia and also in Sudan, the risk of communicable diseases spreading amongst people who are in an informal makeshift camps is significant, and it's quite dangerous. Particularly for young children. We've also heard of diabetes patients who have not been able to access insulin. At least 5 of them have died because of this. We've also seen reports and dealt with psychiatric patients who haven't had their medicines for a very long time. Their families are now reduced to basically chaining them as a last resort. So the health impact of the conflict is going to be lasting, and it's quite intense.
It seems it continues as well. And the astonishing thing is that Prime Minister Abiy Ahmed, he won a Nobel Peace Prize in 2019 for brokering peace with Eritrea. But it seems, by all accounts, that he's been astonishingly heavy-handed, and not only clamping down on this insurrection, but it seems it continues, and it continues right now. We are seeing some sort of international response, but is there any understanding as to why it has escalated, why supposedly a man of peace seems to have gone on what looks like a rampage?
It's a very difficult question to answer, because essentially what we're dealing with here is not peace. What we're dealing with here is conflict. And if you have conflict occurring in such a way where you have military personnel members of armed groups occupying healthcare facilities, that's absolutely unacceptable. That is a violation of international humanitarian law, and that's something that has to stop. So what we're seeing is that a fifth of all healthcare facilities that we were able to visit were in fact occupied by armed forces, be that by members of the Ethiopian army or also the Eritrean forces that have occupied some facilities. Ambulances have been taken by armed men and are used today to transport goods. And we see this often close to the Eritrean border in the north. Now, this is not acceptable because what that does is it disrupts the referral system to get patients from where they are into spaces where they can get appropriate treatment. So this is absolutely unacceptable. Tigray used to have one of the most well-functioning and best healthcare systems prior to this conflict. Today, what we can see is that it's massively disrupted. It's basically been destroyed. And in many instances, it was done in a very targeted and methodical fashion. To give you another example, some of the facilities that we visited, which were looted and damaged, ultrasound machines, monitors, these pieces of equipment were smashed. So with the deliberate intent to render them useless. Now, when we consider what that means, though, is it means that women who are expecting children are not able to come for the antenatal visits, obviously because of the conflict, but also there's no real staff that are working in these facilities. They've fled for fear of their lives, but also they don't have the requisite equipment to provide care. And now women are giving birth at home, often in very abject conditions in these makeshift camps that I've mentioned. And this presents a real concern for the survival of the infants.
Extreme concern. Thank you for telling us what you know, because this is an issue that absolutely must be highlighted, what is going on in Tigray in northern Ethiopia. Thank you very much, Borila Khanse, Head of Communications here in South Africa for Medicine Sans Frontier, Doctors Without Borders.